All right, we're rolling, Gumby Jean.
Hey guys.
We're gonna call him Smash. Smash! How you doing, bud?
Doing fine so far.
You a baseball fan?
I am. Okay.
So here comes the hard part. We're gonna numb this up a little bit. Are you ready?
Yeah.
Gumby Jean's gonna spray a little cold chili spray on that to numb it up with some skin anesthetic, and then I'm gonna inject it. What's he gonna feel? That's good.
Stick, sting, and a burn.
There it goes. She's got it. You feeling it?
Uh-huh.
There you go. Oh, a little bee sting. Oh, it's going slow. Take a deep breath. You're pretty sensitive to it, huh? That's a good sign, though. The sign, because when people say ow like that, it usually means it's going to work better for them. I'm sugarcoating that a little bit. Come on, Smash. You're a tennis player, right?
Yeah.
Now, do you play singles or doubles, or does it matter to
All
you?
the above.
You do both? Okay.
Mhm.
Have you won any big tournaments?
Not recently.
How long were you a pro?
I was a player about 5 years and a coach for 20.
No kidding. Did you win any interesting titles?
Not me as a player, but as a coach I did. I've coached several Wimbledon champions
Is that right?
and coached the United States Junior Davis Cup team for 10 years.
So you're not just a casual tennis player, are you?
No, not.
You take the game seriously.
And I was coach of the Pan American Games U.S. team twice.
Wow. Oh yeah, we got one of these that slides out. Look at that. Clever. So you can slide it back in. That's nice. I like that kind of a safety mechanism. All right, we'll make a little incision here. Hopefully you won't feel much. Now it looks like this has drained once before. Is that right?
Nope.
It's got a little scar or something. Maybe you got scratched there or something at some point. We're gonna make a little incision. You got kind of two of these, so we'll just right there like that. That should do it. Okay, I'm gonna actually retract the blade. I like that, Gummy Jean. That's nice. Did you feel anything?
Nope.
We'll open this up a little bit. We have a very clever, friendly looking epidermoid cyst here. A lot better than the last one we did, right, Gumby Jean?
Oh yeah.
The last one was just a mean one.
I was very angry.
Very angry one we had. Look at that pretty pearl right there. Looks like, look, you're like an oyster. You got a little pearl there.
Dr. McClendon removed his cyst a couple of years ago.
Did
so
he?
I don't know if it was the same one that's come back or whether he...
Well, there's a little scar there. It looks like somebody had done something, but then again, maybe not. It could have been a scratch or something that just happened to be in the same spot. Coming along nicely here. I'm just spreading the skin a little bit. Let me get this little one right out of here first, I think. If I block, you tell me, okay?
You're doing good.
This one may just pop out. It's a nice cyst.
I only have the best.
You brought your best game today, didn't you? You want to share your age with our viewers?
76.
That just came out beautifully, didn't it?
You did?
Look at that. Nice and pearly white. One down, one to go, buddy. That one. No doubt about it. We got it all. It's out. So you had two back here, right? You could kind of tell. Did you look at this? Were you able to get a good look in the mirror with a No, you really couldn't tell. This one's a bit larger. Try to empty it a little bit first. Okay. Look at that. It's just beautiful.
Came out perfectly.
I mean, it's just saying, take me home. I don't want to live here anymore. Take me someplace new.
What causes them?
Boy, I wish I had a good answer for that. Look at that, beautiful. Sac came out completely intact. Nice. I knew this wasn't going to take very long. I could just tell by looking at this was going to be a real clean removal. I had a little neck procedure done due to an injury I had when I was very young, and because I had some nerve damage, and it's left me with a little bit of a tremor that sometimes comes out and sometimes doesn't. But sometimes when I'm doing these little procedures, if I put myself in an awkward position, usually I do that because I want the camera to be able to, you know, to pick up the procedure. Then I'm leaning and that kind of thing. And anyway, so puts me in a little awkward position, and it kind of puts a little more pressure on my neck and upper trapezius and brings that tremor out. Otherwise, I'm good.
Is this the kind of stitch that's going to dissolve, or am I going to have to come back and have it removed?
You're going to have remove it. You can come back and remove it in a week, or you can have a significant other take it out if you'd like.
A year or so.
Yeah. Well, that was as easy as it gets. That was fun. Smash, you're awesome. Thanks for letting us record your procedure and telling us your tennis coaching triumphs and your story. It's fantastic. You're having a little trouble with your shoulder. We're going to get you in for some therapy. Okay, we talked about that. We'll take care of that as well today. All right?
Okay.
All right, my friend. So we'll see you back in a week or so. I want you to keep this clean and dry. We're going to put a dressing on it in a moment. And you can remove the dressing after a couple of days. And if you want to get it wet in the shower, that's okay. Just don't scrub on that area. It can get wet. Pat dry. Okay, don't wipe. Pat dry.
No ointments.
Yeah, and don't put any ointments on it at all. Okay?
Okay.
Thanks, bud.
Stay tuned for the Meta 7 video. I took mine. How about you?
Coconut loves Meta 7, okay? Because look, I could not get comfortable for anything last night. I went to sleep at 1 o'clock this morning, woke myself up around 5, and I have been knocking patients out all day nonstop, and I still have a whole mess of energy. Thank you, Dr. Gilmore, for making Meta 7.
Okay, so you took Meta 7 this morning.
Yeah, I take it every morning.
You take it every morning. And so even though you had a hard time sleeping last night, you took Meta 7 this morning, and now you are a medical assistant machine.
I am a machine. I'm a tank.